In this video, we will learn what diabetes and PCOS are, and what is the relationship between them. PCOS is a leading cause of infertility in women and girls. Usually, 6 to 12% of girls are affected by this disease at the age of puberty. People whose cells block insulin produce insulin, but the body cannot use it, which causes diabetes. In some women, PCOS can also occur due to a high level of androgen hormone. Due to PCOS, girls stop producing eggs for fertilization, and the period of menstruation also starts to be affected. Due to the formation of pimples on the face, the hair on the head becomes weak, and the amount of hair on the face and body also increases. PCOS causes many other physical problems. Most women who have a disease like PCOS have diabetes due to the continuous change of hormones. PCOS can cause gestational diabetes, in which case both the mother and the baby are at risk of developing diabetes. Women who are diagnosed with PCOS are also at risk of heart disease, such as blood pressure, due to which the heart, brain, and kidneys are also affected. Apart from this, heart diseases can also be caused by an increase in cholesterol, such as LDL, and a decrease in HDL. Apart from this, stopping breathing while sleeping also causes heart disease and diabetes. Due to the blockage of the blood vessels, the blood begins to clot, which causes stroke. What are the causes of PCOS? Weight is the cause of PCOS. Does PCOS cause you to gain weight? The relationship between PCOS and weight gain is complex and still difficult to fully understand. Overweight in girls is associated with PCOS. But there are many girls who have PCOS despite losing weight. The second major cause of PCOS is hereditary transmission, meaning a girl or woman whose mother and sister have PCOS or diabetes, which can lead to PCOS. The main cause of PCOS is an obstruction in the process of making insulin, which is usually caused by lifestyle. Women who are overweight either do not consume good food or do not make exercise part of their routine. Many symptoms can be improved by losing weight, regardless of insulin resistance. Do you have PCOS? Sometimes the symptoms are obvious, but sometimes they are less obvious. You should get checked by a dermatologist to diagnose the symptoms, which include acne on the face and body, hair growth on the body and face, and discoloration. Apart from this, you should visit a gynecologist, in which they will check for non-regular menstruation, weight gain, and the invisible symptoms of PCOS. Some women have only one symptom, and some have all symptoms. It is common for women to be diagnosed with PCOS who have trouble conceiving, but the process is linked to girls getting their first period when they are 11 or 12 years old. Apart from this, it can also happen between the ages of 20 and 30. If you want to know if you have PCOS or not, then two of these three symptoms must be present. Due to the non-formation of eggs, the period either does not come regularly or ends completely. In women, growth of facial and body hair, pimples, and thinning of hair on the head are included due to the increase in male hormones. The presence of many small cysts inside the ovaries is also a symptom of PCOS. Ovarian cysts alone are not necessary for diagnosis. There are many women who have cysts in the ovaries despite not having PCOS, and there are also many women who have PCOS but no cysts. How can PCOS be treated? If you have been diagnosed with type 2 diabetes. So how can you manage in this situation? For this, first of all, you have to make changes for good health. If you are overweight and increase your physical activity, you can reduce the risk of type 2 diabetes. Apart from this, there are many medicines that can be used to improve the process of egg formation, and due to this, the process of shedding grains and hair also decreases.